Yes.
Okay, great. So we're going to be talking about retinal vascular
Yeah.
disease. And this is going to include blockages of the artery, blockages of the vein, hemorrhages, trauma. So it runs the whole gamut. So anything that has to do with the vascular system of the eye. So we should begin by just a brief review of the anatomy. Most of the problems that we're talking about occur in the back of the eye. So the top part, you can see the cornea, which is the dome at the top, and the lens, the human lens. And then the large body, the vitreous cavity, which is like a jelly-like substance. We're going to be referring to the back of the eye. This is where the vasculature is. And we have our arteries, arterioles, and venules. These are small blood vessels that go in the retina. And also there's a very highly vascularized area called the choroid. This is between the retina. It's sandwiched between the retina and the sclera. And this is has a very, very high blood flow. And often there are problems with little blood vessels from the choroid that grow into the retina. And this is one of the causes of the wet macular degeneration. So here's an example of a blockage of an artery, which is a very serious problem. It's much like having a major stroke in your body, where the artery is completely blocked and the retina does not get any type of circulation. And this can lead to a marked loss of vision and even blindness. And this is considered a medical emergency because sometimes if you lower the eye pressure, you put the patient on anticoagulants, or you massage the eye, you might be able to help regain some of the circulation of the retina. This is an example of a vein occlusion. And I'm going to talk later about some of the etiologies and causes of this. But this is a blockage of the vein where you get marked hemorrhages in the eye. And this is a branch vein occlusion. You can see there's just a small area here where the vein is blocked. And here's an example of a vitreous hemorrhage where due to trauma, diabetes, detached retina, where the eye becomes filled with blood. The vitreous cavity is filled with blood. So let's begin by talking about the causes, and we can break it up into, let me back up here, by a blockage of one of the arteries. And so what I mean by a blockage, let's say you have arteriosclerosis, and you know your arteries become thickened and hardened. In the back of the eye, the arterioles and venules cross each other. They cross. So if the artery becomes hard and rigid and pushes on the vein, it's going to block the vein and cause a hemorrhage. You also have conditions where plaques can be lodged in an artery. You know, when you have a stroke, there's something called an emboli. This is a material that goes into the arterial system and blocks the flow. So you can have a small emboli that blocks one of the arteries in the eye. There's another whole category called where leakages or maybe congenital abnormalities, where there's a malformation. And also trauma is a big one.
Dr. Conrad, we're missing quite a bit. You keep breaking up.
Well, it's either your connection, but this is being recorded. So if it's not coming in clear, I should have a good recording on this. So my apologies if it's not coming through that clear. Also trauma. I mentioned trauma, blunt blow to the eye, an injury where this causes a vascular problem. So let's look at a retinal vein occlusion. Retinal vein occlusion, a common cause of this is arteriosclerosis. And as we all get older, our arteries become harder, more rigid, and there's a tendency that they may block one of the small veins and cause a hemorrhage. Diabetes is a big issue because in diabetes you have vascular abnormalities and vein occlusions are common. And high blood pressure, also glaucoma, because of the high pressure in the eyes, in some cases of glaucoma, that can cause a retinal vein occlusion. Macular edema, vitreous hemorrhage, all these things can be related to a vein occlusion. Retinal artery occlusion is very analogous to a stroke, where there's an emboli that's lodged into one of the arteries in the back of the eye. And cholesterol is the most common type of emboli, but it can occur from bacteria, talcum powder, intravenous drug use, or any type of foreign material that gets into your vascular system. And when the eye doctor looks inside your eye with a light with his ophthalmoscope, sometimes he can identify exactly where that plaque is located. And as I mentioned earlier, in some situations where you lower the pressure of the eye, you massage the eye, you might be able to lodge that plaque. A vitreous hemorrhage is when blood accumulates inside the eye, and this is often seen with a small retinal tear or a detachment. In diabetic retinopathy, hypertension, because of the extreme elevation of pressure, it can cause a leakage. And also different blood disorders, coagulation defects, if you're taking anticoagulants and maybe your blood becomes too thin, taking aspirin, and also some types of blood cancer can cause the bleeding in the eye. So one of the first things, it's often very difficult for you as a patient to recognize that you had a hemorrhage or a vascular problem or a stroke in the eye. Your first symptom would be your vision isn't good. You have a loss of vision. Typically, it's a sudden loss of vision. You may wake up and no vision in the eye, or maybe you lose part of the vision very, very suddenly. So it is critical that you're evaluated immediately by the eye doctor. Number one, he can determine the type of vascular problem it is, the location. Is it an artery? Is it a vein? Is it a vitreous hemorrhage? And also the extent of the problem. Does the therapies have to be aggressive? Can it be conservative? And also associated factors to consider. Is the pressure elevated? Are there other conditions that need to be treated? Also, it's important to have a medical evaluation, in particular, a cardiac and vascular system workup. Also, a metabolic workup. By that, I mean, do you have diabetes? Do you have an endocrine problem? Do you have a blood dyscrasia? These are very, very important. And also a stroke evaluation, because this is a small blockage of the artery, and it could be analogous, just like having a major stroke. Certainly if you have a stroke, it's a serious issue. You're going to be hospitalized and you're going to be evaluated. You're going to have different scans and cardiac evaluations to make sure you don't have any arrhythmias, things like that. So sometimes a small blockage of an artery or vein in the eye can be a warning sign of an impending stroke or medical problem in the future. I always like to talk about key factors. Everybody talks about genetic factors. Well, I have a family history of diabetes or a family history of hypertension or stroke. And there's an interesting branch of medicine right now called nutrigenomics. And this is the study of nutrition and other influences affecting genetic expression. And the conclusion is the following, that you can control your genetic expression. So if you have bad genes, you can control your genetic expression. And interestingly enough, controlling your genetic expression is the factors that I often talk about. Good diet and nutrition, exercise, positive affirmations, balancing your autonomic nervous system, meditation. all these things. Of course, we have to look at environmental factors. And this includes diet and nutrition. It includes toxins in your environment. All these things may have an influence on the development of these vascular problems in the eye. And of course, the big one is stress. And now, we're faced with the political unrest, the COVID virus. There's certainly a lot of things going on in our society that is causing stress. So you need to develop methods to help reduce that stress, because stress is definitely a big killer. So treatment, let's look first at the medical factors. Certainly controlling your blood pressure is very important, whether it's an arterial blockage, a venous blockage, diabetes, whatever it is. Also correcting atrial fibrillation. Many studies have shown that irregular heart beating can lead to blood clots, which can cause a blockage of the arteries. And also dietary and lifestyle changes are really important. So in terms of alternative treatments, I'm a big advocate that food is our best medicine. We are what we eat. So we need to look at diet and nutrition. And I've talked about this extensively, shifting your diet more towards organic, natural foods, avoiding preservatives, that type of thing. Also begin some type of detox program. Be evaluated for heavy metal toxicity. Most of us do have heavy metals in our body, and develop some type of program to remove these heavy metals. I'm a big advocate of homeopathic treatment because homeopathy treats the entire person. And early on in my homeopathic career, I was convinced of the power of homeopathy when I treated a medical doctor who had a stroke in his left eye, and he was totally blind in his eye. And one homeopathic remedy helped him regain his vision completely. And that was kind of an event that kind of catapulted my interest into getting my homeopathic degree and trying to incorporate that into my medical practice. And homeopathy not only looks at the physical problem, whether it's a blockage of the artery or vein, metabolic, but it also looks at the person, looks at these underlying issues that may be contributing to it. Microcurrent. I love microcurrent. I think microcurrent is the medicine of the future. And as many of you know, because of COVID, I have a lot of free time. I am back in school and I'm getting my master's degree in electrical engineering. In fact, I have a major exam tomorrow, so I was kind of panicking. I should be studying for my test instead of giving this webinar, but I'll be back at the books preparing for my exam. But I do believe that frequencies and these signals that we can send in the body can have a powerful effect, and microcurrent has been shown to improve circulation, stimulate stem cells, and help regenerate the eye. Oxidative treatments are another treatment where we use substances like ozone, which is a highly reactive form of oxygen, which can help regeneration, improve oxygenation and circulation. Also, hyperbaric oxygen. Hyperbaric oxygen is one of the big treatments that many doctors advocate after a stroke. So if you need a refresher, download a copy of my book. If you haven't read it, read it. If you've read it in the past, read it again. The first couple chapters go into a lot of detail about a lot of things that I've talked about that can help improve not only your general health, but also the health of your eye. And you can go to kondrotbook.com, and that's a link, for a free download. So now what I'd like to do is open up the lines for questioning. And there's a couple of different ways you can ask a question. One is you can write something in the chat box. If you're online in your computer, there's a little circle you can click, and I'm checking the chat box here. Or you can just, chime in with your question, and I'd be happy to answer any questions that you might have. So let me open things up for questions.
No, we missed a lot of what you said, Dr. Conrad. We heard nothing.
Is that
So I hope the recording will be okay.
so? Is it just you or everybody? Is there somebody else out there?
It's
I
me
think
as
a few
well.
people have left.
Yeah, it's pretty much everybody.
Huh, boy, I'm disappointed.
A lot of people have left.
So it was probably then from my
Yeah.
end, I guess the
But
connection.
we're here.
Okay, but I see the screen, and it looks like everything's
Yeah.
coming through from my end.
Yeah. Does the message keep?
Sometimes you cut in and then we don't hear anything, and then you come back in, then we don't hear anything, then you come back in. So it was, on and off.
Oh, well, that's very disappointing.
Very broken.
Anyway, we're still here. So if we can, yeah.
I do
The
have a
book, The
question.
10 Essentials to Save Your Sight. Oh, sorry, I was talking there.
Okay, if
The 10 Essentials to Save Your Sight. Can we download that, Dr. Conrad?
yeah, that's a free download. Go to kondrotbook.com, and it's a free download.
Perfect.
And what I'll do is I'll post this. I'll send everybody a link with an email. I'll post the whole presentation
So
because I think the recording took place fine for my end. Okay, other questions? So you can
I took
type a question
off the
in the chat
time.
box.
A question in the program.
Yes, go ahead.
No, was that?
Someone's out there trying to ask a question, but there was some. You're breaking up. I didn't quite hear you. Hello. Okay, I don't know if I've lost the people out there. Hello, does anybody hear me?
We're still here. We're still here.
All right, good.
I hear you.
Hello.
Okay, any
Yep.
questions? Now's the time to fire me a question if you have one.
So I was saying that I wasn't able to come on to previous sessions because of my job, but today I took the time off, and I was wondering, does it matter which order I do the treatment as far as when I do the eye protocols and when I do the I know the light I have to do in the daytime, but does it matter when I do the others?
No, it doesn't matter. I like to recommend that patients do the eye program at night before they go to bed, because the retina tends to regenerate at night, and it makes sense to do the program right before you go to bed, so your eyes are rested and you're sleeping, and regeneration can take place. And then you're correct. It's best to do the light therapy during the day. You should do the light therapy whenever during the daylight hours. If you do it at night, then it may interfere with your circadian rhythm. And of course, in the wintertime,
Okay.
we do not have very long times of daylight. So I would recommend doing the light therapy between 8 a.m. and 8 p.m., even though it
Okay.
may get dark in some places at 5 p.m.
Okay.
And also, it doesn't matter the order you do the programs. I mean, some people like to do the stress program before the eye program, or do the stress after, or do the detox. But remember, your main program is the eye program. And also, for
And
those of you that
one
may
more
not be
question.
aware, we have developed a method of recalibrating, reprogramming your machine while you're at home. We would get an internet connection, and you would plug your microcurrent machine into your computer. So this is a major advance that will have the flexibility of maybe changing some of your programs, which I think is really going to be great. Because in the past, when I first began doing microcurrent, we would have patients come into the office for a week, and I would run different frequencies, select different frequencies. And it was rather a tedious process, because at that time I really didn't have eye protocols for various diseases. So we would be testing different frequency patterns. So now with this new software, it's a major development. We can have the flexibility of maybe adding different frequencies and signals in your program to help you along with your healing. But I do recommend that we don't change anything until about 3 months. So if you're doing the microcurrent for about 3 months and maybe you're disappointed, or maybe your progress isn't what you expect, then we might be able to add a different frequency or a different current. We have the flexibility for doing that. So I'm kind of excited to begin to work with you on these different parameters.
And the light therapy, I can only do that once a day for 10 minutes?
I would recommend once a day. On some special circumstances, you can do it twice a day. Sometimes if you have uncontrolled glaucoma and maybe a retinal hemorrhage or something, a lot of edema, we might recommend twice a day. But to remember, all these therapies, it's just gentle stimulation. That's the key, gentle stimulation. We don't want to push the body too hard. These are long-term treatments to gently stimulate your body. Let's say you're a track runner and you want to train for a marathon. You begin by running maybe half a mile every day gradually. You don't go out and run a marathon the first day for training. You're going to get your body into trouble. So we don't want to overwhelm the retina. Also, remember this: we're sending signals into the body, and these are kind of reprogramming your body. So it's not like you have to continue all this for, longer isn't better. We're sending brief signals in to kind of regulate your body and instruct your body what to do.
Okay. Thank you.
May I ask for some advice? We're here for a reason, and I'm here because I found traditional approaches and allopathic medicine just not to meet my needs. And yet I've heard you say a few times to ensure that we are still consulting with a regular eye doctor. It's daunting to step into an office where you feel misunderstood, where they're not validating any hope, and where they want to really reinforce genetics and have a very narrow perspective. In general, do you have comments or advice? As I'll speak for myself, I navigate not having a doctor or a group of doctors I feel I'm on the same page with, and yet I recognize the need to have someone like that in my care.
Well, I agree. It needs to be a partnership. You know, I wear two hats. I'm a board certified ophthalmologist. I still do surgery, although I do feel that the alternative approach is much better, and I like to treat the underlying problem. So it's a partnership. So it's very important that you do maintain a relationship with a traditional eye doctor. Now, whether you follow his recommendations or not, that's up to you. And that's where I come in. I'd be happy to consult with you to determine whether you need the surgery, whether you need the injections, or whether there's an alternative solution. It is also very important for me because of COVID. I'm not able to actually examine your eye, so it's important that I get a good copy of your eye record, so I know what's getting on. I mean, you could tell me, oh, I got blurred vision on my left eye. What can I do, Dr. Kondrot? I have no idea. I have to have records to see exactly what's going on in your eye so I can give you the best advice. Now, many of my patients, what they do is they just tell the eye doctor, you know, I'm trying some alternative treatments, seeing if it can help. I'm, you know, changing my diet. I'm doing this. And of course, if any of your eye doctors want to talk to me, I'm always very happy to talk to them. There is a growing number of eye doctors who are beginning to look at these. Unfortunately, the numbers are not that great in the US. In Europe, I'm a hero with the Italian Ophthalmology Society. They made me an honorary member. I've spoken at many meetings in Italy. I wrote a chapter on vision therapy in a major textbook that was written in Italian. You know, so it's becoming, you know, eye doctors are becoming more aware. But I think it's up to you to maybe educate them. And of course, if they want to talk to me, I'm always happy to kind of educate ophthalmologists and eye doctors that there are these alternative treatments.
I can understand what the last person was saying, because I went to my eye doctor and he said my eye pressure went up, and he insisted that I took another eye drop. And when I asked him, can I do anything, like, because I'm on the computer from 7 in the morning to 7 at night teaching, and I asked him, can I do, is there any recommendation for rest or eye exercise? He said, no, none of that don't work. You can't do none of that. Don't do that. I said, I'm working with a doctor who believes in non-traditional. No, help you just take the medicine, and that's all you need to do.
Yeah, well, that's a problem. But let me just
And
comment
that was
about
his
the computer, because there have been some studies to show that eye strain can cause an increase in your eye pressure. And what I recommend for all of my glaucoma patients, if they do a lot of computer work, is to get a pair of glasses specifically for your computer. Get the focal point right at your computer. So you can go to an optician or an optometrist and get measured for computer glasses. The goal is to completely relax your eyes when you're using the computer, because eye strain causes tension in the ciliary muscles, and that can cause an increase in your eye pressure.
Would glasses for Bluray help?
Well, our eyes need blue light during the day, but at night we should avoid blue light. And they do have blue blocking glasses. So if you do a lot of computer work at night, I would recommend blue blocking glasses. I interviewed a researcher, Dr. Abraham Hayam, about the problems of blue light at night. And there's a podcast on that. If you go to Kondrot podcast, it's very interesting. He feels that this is one of the biggest medical issues in our society is unwanted blue light at night. We have the compact fluorescent lights now, which are producing blue light. We're spending so much time on our iPhones and computers, we're getting exposed to blue light. And this is definitely causing a problem, not only with our autonomic nervous system, but it is causing an increase in many chronic diseases, cancer, diabetes, obesity. We were meant to not have exposure to blue light at night. We want the red spectrum at night. When the sun sets, it goes from blue to red. So we need the red light at night, not blue light. Or the best thing is get a good night's sleep. No light at all. No light at night.
May I ask a question about dry eyes? I've noticed recently that, aside from the weather changes in the Midwest, I don't feel like my eyes are as lubricated. Is there anything in general that you can speak to? You're going to tell me to drink more water, aren't you?
How did you know? Well, in the wintertime, with forced air heating, the humidity tends to be low, and the dry eyes are more of a problem. So I'm a big advocate of ozonated eye drops. I love ozonated eye drops. If you're not familiar with them, go to YouTube and put in my name and ozone. You make your own ozonated eye drops. Ozone's a highly reactive form of oxygen, which helps reduce inflammation of the eye. Also, there's many other things that you can do. Being female, if there's hormonal associations with dry eyes, and diet. In addition to drinking more water, diet. Eating more organic fruits and vegetables can be very beneficial. Eliminating toxins in your body, all these things. And also homeopathic treatment. I've had very good success with homeopathy because, usually the dry eyes are associated with other problems, tension in your body, maybe other conditions which are going on. So we look at all these things too when we do the homeopathic evaluation.
Thank you.
I just have a question on using these detox, the suppositories for eliminating, let's say, lead or mercury or whatever. How long do you do that for? I know it's 3 times a week, but do you do it for a month and stop?
Well, I got some bad news.
Or
it takes a long time to remove those heavy metals. The half-life of lead, by half-life, I mean, how long will it take for that lead to leave your body if you don't do anything? The half-life is 99 years, believe it or not. I've been doing chelation for about the last 30 years. Now, I don't do the rectal suppositories, every week 3 times, but I've been doing the suppositories, the oral and IV, for 30 years, if you can believe it. And it takes a long time.
gosh,
It takes a long time to get the lead out of your body, but it is improving my circulation. It's helping me with my mental acuity. I'm 70, and right now I'm back in school with 20-year-olds studying electrical engineering, and their minds are pretty sharp and their circulation's pretty sharp. So far I'm able to keep up with them. So, as we get older, we're constantly being exposed to these heavy metals. So it's a long-term goal. It's a long-term goal. Now, some people have great success.
yes.
They do a couple of months and all the lead's gone. So there are some underlying conditions. One is called a methylation defect. And many people have this defect where their body's not able to detoxify as readily as most people. So it depends on some factors. My advice is do the chelation faithfully for a couple of months, and let's recheck your urine for heavy metals. But even if the lead is back to normal, you're being exposed to these toxins every day, and I think it's just a good part of maintaining your health. Detoxification.
Okay.
And I'm new here. Could you help me understand where I can get more information about the chelation process? Is it in your book, or is it additional material that each member has sought out on their own?
You can go download my book. I have a chapter on chelation. And actually, I wrote a book on chelation. I interviewed 20 doctors who are using chelation in their practice. I think you can Google chelation book or Kondrot chelation. It's a great book. Or call the office on that book, and it goes into detail. Or also search on YouTube chelation Kondrot. I have done some podcasts in the past on chelation. And then maybe that could be another topic. If the group is interested, I could talk on chelation maybe at our next meeting. So maybe it is very important. So thanks for your suggestion. So January, the first Wednesday in January, we'll talk about chelation. And it's probably very appropriate because after the holidays, everybody's going to be toxic, right? Drinking, overeating, celebrating. That would be a good way. We can begin the new year by talking about chelation.
It's just so expensive. That's the problem.
Well,
for me, it's expensive.
I'll address maybe some inexpensive ways to detoxify at the next webinar, our next meeting. That'll be the first Wednesday in January. I'll talk about different ways. And of course, the best way to detoxify is drinking plenty of water. That's one way. And eating healthy organic food. Because when you're eating healthy organic food, especially vitamin C, that is a natural detoxifying agent. Dr. David Williams mentioned that cilantro, it's God's gift to mankind for detoxification, cilantro. And cilantro grows like a weed. You can grow cilantro in your garden, even on your windowsill during the winter. The Vietnamese have a very low incidence of heavy metals because they put cilantro in all their food, in soup, sandwiches. They don't use lettuce, they use cilantro. So if you've ever been to a Vietnamese restaurant, the soup is just loaded with cilantro. So that can be a good way of detoxifying. But we'll go into that next meeting. It's hard to believe that I'll be meeting with all of you next year. So I want to wish all of you health and safety over the holidays, and Merry Christmas, Hanukkah, Ramadan, everything. I hope all of you have a wonderful holiday season. And the office, if you do have additional questions, don't hesitate to contact the office. I meet with the office staff every day. We have an office meeting. We go over questions that you may have. But the first Wednesday of the month is a good opportunity for us to get together, talk about different topics. And I do appreciate your questions because, no matter what the question is, I'm sure somebody else is thinking about asking that same question. So don't be shy. And you can also text me, or not text me, but go into the chat.
Email.
Yeah. And then I'm gonna have to work on the internet connection. There may have been a problem here, but it seems like we're coming through fine now. Maybe it was just overburdened when I was showing the slide presentation. Okay, well, if there's no other questions.
I have a question in relation.
Yes.
Oh, just a quick question on the microcurrent. For the moment, I'm not going to do anything about changing it. But my question to you is, number one is specifically for the eye. When you go to reprogram the device, do you alter the specific program for the eye, the number one?
Well, the program number one probably has about 30 or 40 different frequency pairs. Each frequency pair has a different function. So what I will do is look at the status of your eye, and then we may look at changing some of the frequency pairs, not the entire program. I may add some frequency pairs. I may alter the current on some of them. So in other words, we'll fine tune it. I may want to alter the current setting, maybe to increase the intensity a little bit or actually lower it, depending on what's going on.
Okay.
And also, as you get experience using the microcurrent, I'll let you have the opportunity to regulate some of the parameters. I don't like to give patients too much flexibility early on until they use the microcurrent for at least 3 months. And after that, maybe you can regulate the current setting and change some things. We can talk about that. But most people do not need a change in their microcurrent setting. I would say maybe 10 to 15% of people will need to change. The key thing is to use the microcurrent on a regular basis and also do the necessary steps that are going to help the microcurrent to work. Because remember, if you have poor nutrition, if you're dehydrated, you're under stress, and you have elevated heavy metals, microcurrent's not going to help you. So those parameters are important to take care of. A healthy diet, good hydration, reducing stress, no heavy metals. But of course, if you didn't have those things, you probably wouldn't be needing microcurrent. So, but anyway, the microcurrent's going to work much more effectively if your body's healthy, you have the building blocks for regeneration, and you don't have those heavy metals which are interfering with the effect of the microcurrent.
Doctor, before you go, is your office going to get back with me concerning the heavy metal test to kind of give me a feedback as to?
It usually takes a couple of weeks, 2 weeks, I would say, before we get the results, and they will contact you. If you don't hear from them in 2 weeks,
that was months ago.
You should give them a call because maybe there was a mishap. But usually they're pretty good.
All right, cool. Thanks.
They're usually pretty good about that.
All right, thank you.
Okay, I want to thank everybody for joining, and happy holidays. Stay healthy and safe, and I'll look forward to meeting everybody again soon. Okay, take care, everybody.
Okay.
Same to you.
Thank you.
Bye-bye.